First off, if you could just explain what exactly is Abridge and what you do.
Yeah, absolutely. It's a privilege to be here. We're a company focused on using AI to bring the most important people in healthcare, patients first and foremost, but also their clinicians, their doctors and nurses. We want to bring them closer together. And there's so much clerical work, there's so much administrative work that really separates them, pulls them apart. We can use this technology to assist, to augment, even automate so much work so that they can really focus on each other.
What does that mean? Break it down for us. So what is it actually the platform is doing or the tools doing for doctors in the healthcare community?
Yeah, so maybe in the recent past, you or your family member, you've seen a doctor, you've been in the hospital or in a clinic, and you're there, and perhaps they have their back turned towards you. They're focused on typing into a record. They're taking notes the whole time. They're looking down. They're distracted perhaps by all the calls that they're getting. They're getting pulled in any number of different directions, and they can't be fully present, focused on delivering the best experience and the best outcome. With Abridge, they can turn the app on and then just fully focus on being present, making eye contact, taking a better history. He really listening to their patient, because in the background, the technology is taking notes for them, but also doing a lot of the other tasks that happen afterwards. They have to put in the diagnoses that they addressed. They have to put in the specific orders that they administered, and then they have to sort of follow up on the patient. So imagine every single one of those clinicians now having a team of assistants, of agents, basically, that can work for them in the background 24/7. That's what we're building.
So is this more about a bedside manner? Is it about cost? I mean, what does it come down to? A mix of both?
It's a mix of both, really. It's a really great question. So in this country, but also around the world, clinicians, doctors, they're not compensated for the care that they deliver. I'm a practicing cardiologist. We're compensated for the care that we documented that we deliver. And so what that means is that as we're talking to our patients and listening and coming up with a care plan together, we have to document that correctly, accurately, and then we have to put in that information in a very specific way in order to get reimbursed, in order for that patient to get authorization for that medication that can save their life. So imagine a world now that we're in where this technology, where Abridge is doing all of that work for them. What can we redesign? One of the things that we're working on right now, and we had a keynote just a few weeks ago in New York City, where we had not just health systems on stage with us, but also insurance companies on stage with us. We also announced an investment from Eli Lilly. We have all the stakeholders now coming together to figure out how we can redesign these flows to benefit the patient. So doctor sees patient, can they just get paid immediately? Doctor sees patient, can we do the prior authorization essentially in real time? And doctor sees patient, can we help the clinician feel like a superhero knowing what clinical trials the patient is a candidate for so that they can bring it up on the spot and enroll them?
How accurate is like the note taking, and how do you make sure that it is accurate? Because something charted incorrectly can often stay with a patient for a long time.
Yeah, we're at scale now. So we're live across well over 300 of the largest health systems in the country. In the next 12 months, we'll touch well over 100 million encounters. And so we're at real scale. And over these last years, we've been able to pressure test our technology and understand where we are and where we need to improve. And that's how we build trust with our health systems as well, being transparent. Now, think about this technology. At the bottom of the stack, there's speech recognition. And really no doctor out there knows how to pronounce all the different medications for the chemotherapies out there. And our challenge is we need to recognize all the ways they say these words, the symptoms, the medications, the diagnoses, and the procedures. But then beyond speech recognition technology, which needs to also work across all the different languages, we have to be able to work for all the different specialties. I'm a cardiologist. I practice very differently than an oncologist does, than a primary care clinician does, than a rheumatologist, et cetera. But then we also need to structure all of this information in a way that makes sense. And there's style to that, there's structure, there's content, and then we have to integrate it into the systems of record that the entire industry depends on. And we measure how well we're doing across all of those different layers of the stack. And we're also always improving. But we're definitely at the point where this is technology that is just taken for granted. It's in the air. It's infrastructure, essentially.
All right. So forgive me. I didn't hear. So how accurate is it? I understand the parameters and what you guys are dealing with. And I realize none of this stuff, you flip a switch and it all works. But in the pressure testing, what are the problems? Is it picking up on medications? I don't know if you guys have a number yet, and I understand this is a work in progress to some extent, but what can you tell us about how accurate? Again, I'll go back to this kind of information is so important.
Yeah, absolutely. I would say so in the speech recognition world, we're best in class. The major metrics that are important are word error rate and medical term recall. We're well over 95% across those metrics. In a large language model, sort of AI world of generating these summaries, we have similar metrics that are well over 90% as well. Where it gets tricky is that to some extent, the devil is in the details of the scenario, of the specialty, of the specific language that was used in the conversation. And that's where you're going to see some heterogeneity. And that's where we just have to be transparent about it so that we can deploy this responsibly.
Now, you mentioned you're a practicing cardiologist. So how are you balancing both of these, this company and doing this? I mean, that's not a side gig. This is a serious thing. And also on top of that, how has that perspective kind of helped prepare you for what you're doing now?
Yeah, I still see patients about one weekend a month. And I'd say that weekend is work for Abridge as well. I get to, number one, stay close to the mission of the company, and that's an incredible privilege that they let me do it still. And I get to learn from residents and fellows, and most importantly, from my patients. But also I get to use the technology and bring those insights back to the team. And so that's why it really feels like it's all synergistic. I used to be an investor, a corporate VC for a large health system, got to invest in companies and got to sit on boards and also invest into Carnegie Mellon University. We started a machine learning and health program where my co-founders, professors at Carnegie Mellon, come from. And I'd say these last 4 years, especially in healthcare, I think you got to this in the opening, they are just absolutely unprecedented. I'd say this is the industry that has recognized that AI can absolutely transform and can really truly make care cheaper, better, and faster.